Last but certainly not least, Robert Stevens, Head of Digital Strategy and Medical Innovation at Novartis.
Thank you. Thank you so much. So I want to preface what I'm about to talk about with you by making it very clear that digital transformation, whether it's voice or another technology, is very much a behavioral transformation. And so there's three things that really excite me about this conference. The first is that it is, by the way, disclaimers are great for buying time in this type of session. First is that it's a conference fully dedicated to the voice in healthcare. It's not a separate session, and it's not a breakout session. Okay. The second thing is that people are buying devices, they're having multiple devices, right? People have multiple Echo Dots in their home, not just one. The third thing, and most importantly, is that people are differentiating what a digital virtual assistant is, and they're moving away from thinking about it as a singular device like Alexa, right? And that's really important because when you think about opportunities for the pharmaceutical companies, there's an ecosystem that's really set up, right? And so what you see on the left-hand side is really what the form factor is that pharma needs to think about, right? What is the right form factor for the healthcare professional, for the patient, for the caregiver, and also what's the where and the when? At what point are you using the digital virtual assistant at home, in the office, cars that are Alexa enabled? What about at the patient point of care? And what about when the patient goes home? And this is where behavior really becomes really important. So what we did is an 1,800 person survey of HCPs, ex-US and US. 7% were US, 30% were ex-US. And we really pretty wanted to drill down on what are you comfortable using a digital virtual assistant for in the exam room in front of a patient, and what are you not comfortable using it, right? Because we've had anecdotal discussions with physicians where they've said, I don't want to be usurped by a smart hockey puck in front of a patient. And so we really asked these physicians, 1,800 across the globe, on those four areas. General consensus shows a willingness to use digital virtual assistants at the patient point of care. This is great. Nurses show 85%, right? And so from a pharma perspective, we're thinking, what is it about the nurses that make them more receptive? So if you're thinking about a heart failure clinic, and nurses have a dominant role in a heart failure clinic, what's the right strategy there? Med students as well, doctors a little bit less, but it's very similar. We really drilled down on use cases of using DVAs at the exam room as well as in the patient office. It's really a push-pull type of strategy. If the physician or the healthcare professional can push out content, push out a script to a pharmacy, find coupons, right, or provide the patient with follow-up information, that's where they really most preferred. In the private office, it's very much a pull. They want to pull guidelines, check dosing, and access medical education. Least preferred, we heard things were all over the map, but the bottom line here is that I talked about behavioral change. Anything that challenges the physician-patient relationship, that makes the patient feel skeptical or doubtful of their patient, or makes the physician feel as if they're being challenged, is not going to be a good use of voice, right? And so we have to be very careful as we as a collective industry, pharma or not, think about what are the right use cases. We didn't leave it there, right? Because we really wanted to also think about what is the voice of the patient in all this. So if physicians are saying that they're uncomfortable with using clinical decision support enabled AI through Alexa when a patient comes in on a consult, what's the patient say? And so we interviewed about 700 patients in the US across 3 different categories during their consult, prescription guidance, as well as clinical trial usage. Some of this was touched on. And so what we find is this: during a visit between a patient and an HCP, a little more than half were open and comfortable with Alexa, and I'll use Alexa as a surrogate for every other cousin that Alexa may have, comfortable using it. The irony here is that millennials were less comfortable, okay? When it comes to using Alexa or a digital virtual assistant to update the EMR, EHR, again, a little more than half comfortable, but again, millennials were still less comfortable than non-millennials. Millennials defined here as 22 to 41 years of age. Here's where it gets even more interesting, and this is why behavioral change is really important here. When it came to using a digital virtual assistant to check dosing or to check for contraindications or AEs, where physicians see a bigger need, patients feel more uncomfortable. Why is that? Why is that? And here it flips, right? Here millennials are more comfortable, right? And so rolling out digital strategy, I think that Emerson may have said it, we have to be really strategic about it. Bottom line is that we have to give a lot of thought around behavioral change and what that looks like in the healthcare system. Thank you.